Good morning, everyone from Manila, and good afternoon and good evening to our panelists and participants who have joined us today from different parts of the world. My name is Sona Shrestha, and I am the Deputy Director General of AEW's Independent Evaluation Department. Today, I'm very pleased to welcome all of you. The session, as you know, will focus specifically on various aspects of real-time and formative evaluations. And we'll get to hear perspective from UN agencies as well as from the Asian Development Bank. As you know, the unprecedented nature, the scale and the scope of the pandemic has challenged us evaluators as well to be more innovative and agile in our approaches. And many independent evaluation departments and agencies, if not all, have adapted and undertaken evaluation approaches and methodologies in some form of rapid assessment, real-time evaluation, formative evaluation, etc., as opposed to the more typical ex-post summative evaluation that our departments typically do. And indeed, these approaches have a lot of potential in terms of serving as a powerful learning tool, as well as in some instances, accountability tool. By providing early and emerging lessons, they can be helpful in terms of shaping policy discussions and program design during early phases of crisis response, and also facilitate course corrections when necessary. But there is a lot that goes into making these rapid evaluations or real-time evaluations useful and effective. A lot of questions and considerations that need to be asked upfront in terms of the design, the methodology and the approach, the timing, the staff resources, so on and so forth, given that the situation on the ground is fast evolving and uncertain, and likewise our organization's support response is also evolving to reflect the changing situation in the ground. Of course, there are a lot of challenges, opportunities, but challenges that evaluators have to overcome when designing and implementing these evaluations at very rapid paces. And importantly, what are some of the lessons learned from the recent COVID-19 experience in terms of from the evaluation perspective? So to help us answer these important questions, we have an excellent and highly experienced group of panelists this morning. And it is really my great pleasure to welcome them and introduce them. I'll start in the order of their presentation. First, we have Mr. Richard Jones. Richard is Chief of the Capacity Development Section and Senior Evaluation Advisor with UNDP's Independent Evaluation Office. And during 2021 and 2022 in particular, he led IAO's formative evaluation in the context of the pandemic, as well as looking at some of the longer term issues in relation to the impact on SDGs and SDG financing in particular. Welcome, Richard. Second, we have Melinda Sutherland. Melinda is Principal Evaluation Specialist at AEW's Independent Evaluation Department. And Melinda was also a co-team leader of IED's real-time evaluation work in the last couple of years. So she will share some details of AEW's experience in conducting this series of real-time evaluations. Welcome, Melinda.
Thank you.
And our final speaker is Ms. Jane Mwangi. Jane is Senior Evaluation Specialist and Team Leader for Humanitarian Evaluation Portfolio in UNICEF's Evaluations Office. And during 2020 and 2021, Jane worked with all seven regional offices of the UNICEF to roll out real-time evaluations assessments, evaluation and assessments of UNICEF's response to the COVID-19 pandemic. Welcome, Jane. Before I hand over to Richard to start with the presentations, just a couple of housekeeping points. As you know, we have allocated 90 minutes for this session. The first 30 to 40 minutes will be presentations by our three panelists. Richard will start by giving us a fairly comprehensive overview of his work at UNDP, and Melinda and Jane will supplement those with experiences of ADB and UNICEF in order to show some of the similarities, I'm sure, in the broader approaches, but also some of the differences in light of the specific circumstances and objectives of the evaluation. And after the presentations, I will get the discussions going by asking each of the panelists a few questions just to stimulate the discussions, but we'll be sure to, and I'll do, depending on the time, 2 to 3 rounds, but we'll be sure to leave enough time at the end to take questions from the audience. So with that, thank you again for joining, and over to you, Richard.
So good morning or good evening from New York. It's a great pleasure to take part in the 2022 Asia Evaluation Week. Thank you to the organizers for this opportunity to present the work of IEO, which it undertook evaluating UNDP's response to the COVID-19 pandemic and also SDG financing. It's also a great pleasure and an honor to join this virtual podium with Sona, Melinda, and Jane, who I've got to know over the last couple of weeks, and I hope to meet them one day in person. The formative evaluation which I'm introducing here was completed earlier this year, and it focused on UNDP's initial pandemic response, but with a specific focus on UNDP's positioning to support the recovery from the pandemic through strengthened access to SDG financing. The remit spans early measures taken in the first months of the crisis, so from March 2020 through to June 2021, and that included UNDP's technical lead role within the UN system for the development of socio-economic impact assessments and recovery plans, and ongoing programs aimed at aligning the financial resources to the SDGs post-pandemic. We had 3 guiding questions. How effectively has UNDP supported the pandemic response in program countries? In its role as technical lead for UNDP's socio-economic response, was UNDP able to inform the development of policies geared towards the SDG recovery? And the key question going forward for the formative evaluation was, do the tools and approaches currently being deployed by UNDP to support an SDG recovery through the mobilization of new and additional finance position UNDP well? So why the specific focus on SDG financing? It was clear at the start of the evaluative process in January 2021 that many countries were facing considerable challenges beyond the health impact of the pandemic the pandemic itself. And there was a clear emerging SDG crisis with initial implications of an additional 170 million people being pushed into poverty, as well as declines across other SDGs and human development in general. There were initial indications of a decline in human development, which was borne out recently in the 2022 Human Development Report, which was released last week by UNDP, that highlighted that 138 countries saw a decline in their human development over 2020 and 2021. The development crisis was and is being exacerbated further by an emerging fiscal and financial crisis, with many LDCs and middle-income countries seeing considerable economic impacts and reduced revenues coupled with increased expenditures to respond to the crisis. During the crisis, UNDP had taken a leading role in supporting the economic response developing 140 socio-economic impact assessments to support governments in identifying the social and economic impact and enabling them to respond accordingly. UNDP had also recently expanded its development offer to SDG financing, which started, actually has a long history, but really came together from about 2019, just as the COVID was hitting. They supported 70 countries in developing integrated national financial frameworks. They support climate finance, tax revenue development through Tax Inspectors Without Borders, as well as supporting countries, a number of countries, with the issuance of sovereign bonds linked to SDGs and environmental investments, including sovereign bonds in Indonesia in the last few years. So why formative? Why a formative approach? We took a formative approach as we also recognized that it may be too soon to attempt to assess the effectiveness of actions undertaken in response to COVID. This is in January 2021, given that the pandemic was still ongoing and we didn't have a clear picture of how the pandemic was going to translate. Equally, many of the UNDP SDG financing tools were still in their early stages, and in many ways the SDG financing approach was still being designed and refined, and finding it's embedding itself down at both the headquarter, regional and country office level. As a result, the evaluation wanted to contribute more to the conceptual clarity and also the operational implementation and measurement going forward of these tools, and try and help UNDP position itself better. This has also impacted the level to which we were able to, the pandemic rolling out also impacted the level to which we were able to really focus on the effectiveness of COVID-19 response, as well as the SDG financing approaches. Equally, although impact and sustainability of interventions were not fully assessed, the adequacy of the program design to allow for future impact and sustainability was considered. Being formative, it is hoped that the findings will inform the design and direction of UNDP's support to the recovery from the pandemic, and importantly, it supports financing the SDGs in order to ensure their achievement and the attainment of the 2030 agenda. So, given the formative nature of the evaluation, it was important to examine the current and emerging SDG financing context. And if you see the report, you'll see we place much more analysis, time and focus on SDG financing and financing in general, looking at the impact of the pandemic on the SDGs, examination of the SDG financing gap data, which at the time of the evaluation put the financing gap at $4 trillion, an increase of about $1.2 trillion on the pre-pandemic era. Understanding of the shrinking fiscal space and the two-tier recovery that was emerging because of the fiscal and financial gap. With this in mind, our analysis, we framed our analysis of SDG financing around domestic resource mobilization. This is UNDP support to domestic resource mobilization, international public finance, and private finance capital markets. This analysis helped to place UNDP's work in a broader context of SDG financing. So just quickly, because the report came out with 7 conclusions and 7 recommendations, but in general they positioned around 2 key areas. The evaluation identified a number of strategic positioning and programmatic recommendations that stood out, and if addressed, we felt will position the organization as a better interlocutor in the SDG financing discussions, both globally and at a country level. Strategically, we felt in order to strengthen UNDP's work in SDG financing at the country level, regionally and globally, the organization needed to develop a clearer roadmap outlining how the organization's work and resources would support the UNDP's strategic plan of aligning $1 trillion with SDGs. That's not providing the funding of $1 trillion, but working with countries and regions to align available funding with the SDGs. This strategic need included a need for a clear climate and energy financing strategy, as well as linking the global advocacy work that UNDP does with more downstream country level work. Programmatically, we highlighted the need for the organization to further strengthen a number of its key SDG financing tools going forward, including work in sovereign bonds, especially the growth of SDG and climate-related bonds. We also felt the work in standards, which UNDP was looking at, was going to face challenges given the number of standards in the market. And we all know there's a big discussion currently around ESG standards and climate washing. So the challenges and the opportunities, or opportunities and challenges. Well, utilization. The evaluation broke new ground in ensuring a more participatory trajectory between IEO and UNDP in general. This has since been further taken forward in IEO's current evaluation of UNDP's work in leaving no one behind. As mentioned by Sona, this is the first time we had done a formative evaluation. So it was very much a learning experience, both for ourselves and for the organization as a whole. And that led to the second opportunity or challenge, which is the understanding and acceptance of a formative evaluation versus a summative evaluation. This was the first formative evaluation undertook by IEO, and it was not an approach understood and in some ways welcomed by the organization. Time was taken to ensure this was done in a participatory manner and engaging the evaluand throughout without jeopardizing the independence of the reports in the office. A new ground in ensuring more participatory trajectories for IEO evaluations and strengthening of learning and use of findings is also a benefit. The actual timing was positive and negative. It was seen by some as too soon to evaluate UNDP's COVID-19 response, given that we started in January, but we really only started writing in June, so 18 months into the pandemic or so. Equally, UNDP's SDG financing tools were seen as too new to evaluate. However, the launch of the new UNDP strategic plan in January 2022 also provided an opportunity to influence a key enabler, that is SDG financing, of UNDP's work going forward. Another key challenge, and we can talk about this a bit more in the conversation, was access to data. This was a major challenge. Data on SDGs and overall financing was tentative at best, and for the SDGs in many cases was old. It just hadn't kept up with the pace of need. Impact of the pandemic on the SDGs was the data was mostly predicted, especially for fiscal and financial data, and we had to rely on this. But still, going forward, we feel it was a very positive process. The management response that we received, just let me clarify, we finished the report in January. We went through all the processes that we needed to go through, finishing it in March, and presented it to UNDP's executive board in June 2022. So you can see it's still very fresh. So when I'm talking about the positive take-up here, we've still got a long way to go, I think, and many of the recommendations will not actually be taken up for another 6 to 12 months. However, the initial management response did recognize the need to strengthen UNDP's strategic offer and reorganize the work streams under SDG financing to ensure they had a broader and more targeted impact. Some initial movement has been seen, and UNDP has strengthened its offer in public finance and is also reviewing its SDG impact management and tracking finance, as well as climate finance work. And as mentioned at the beginning, this has opened up the door for more formative and more participatory evaluations with UNDP as a whole, if that's the direction we want to go through. So I welcome your questions after the further presentations from Melinda and Jane. And now I will hand over to Melinda to present the ADB experience with real-time evaluations.
Thank you, Richard, and thank you to the organisers of AEW for the opportunity to talk about the ADB experience. So I'm the real-time evaluation co-team leader for ADB, just before I really talk about our evaluation, to set the scene on what we were evaluating, the ADB total allocation for COVID was $29 billion, and this included a $29 billion package of budget support to support countries to address the health, social and economic impacts of the crisis, as well as a $9 billion vaccine facility, which was announced in December 2020. To date, ADB's approved 299 projects and committed $33 billion to the COVID crisis. So our real-time evaluation was undertaken to provide our board of directors with observations and analysis as the programs were being implemented, to enable them to make evidence-based decisions and initiate course corrections if needed. Supporting this, the purpose of our evaluation was to assess during implementation the relevance, efficiency, coherence of ADB's COVID-19 crisis response, as well as the early signs of effectiveness. And this was done to identify emerging lessons and progress in achieving ADB objectives. So our real-time evaluation is essentially covering the period from March 2020 to December 2022. We delivered 4 notes to our board, with most of the work occurring on those notes from October 22 until the presentation of 2, when the 4th note was delivered. We're also in the process of developing a capstone report to document the role and contribution of IED during the pandemic, which we plan to share by the end of this year. Our notes identified findings that emerged up to 2 years into the pandemic, and they didn't attempt to offer a comprehensive or conclusive evaluation of all ADB support. And this helped us to really pick our path in the approach and methodologies that we use, because we were very firm in our mind that we were providing deliberative material for the board and management to use during the crisis. And for these reasons, we didn't include formal recommendations in our notes to the board, and we also didn't share the notes publicly. So the overarching question underpinning our evaluation was how responsive, relevant and on track towards intended results has ADB's support been to combat the COVID-19 crisis, and what lessons can immediately be applied to ongoing as well as future operations. Now, underpinning that, there were 4 sub-questions, and they related to relevance, efficiency, effectiveness, and how well prepared ADB was to adapt to the new challenges. So the first sub-question was, how relevant has ADB's response been to the needs of developing member countries to tackle the crisis? How efficient and coherent is ADB being in allocating its resources to support the Asia-Pacific region during the crisis? How effectively on track toward the achievement of intended results and outcomes are ADB's pandemic-related interventions? And how well prepared was ADB, and how quickly has it been in adapting to the challenges posed by COVID? So really importantly here, there's no one agreed definition of real-time evaluation. It really does mean different things to different organisations in different sectors and to different evaluators. And what we've seen is general consensus that a real-time evaluation is a formative evaluation undertaken during a crisis, and it generally has 5 key characteristics. They are the collection of real-time data, the provision of real-time reporting on evaluation data, multiple timings of evaluative activity, multiple learning loops, and the provision of data and information to decision makers to enable planning and course correction, and in a timeframe where that can still make a difference. So ADB's real-time evaluation met the 5 characteristics, and in doing so was really quite different to other formative evaluations that we normally undertake. We really found that real-time evaluation was used to almost bridge a gap between monitoring and evaluation in the crisis context. And for this to be possible, we really needed to be flexible and adaptable as evaluators to almost step into a pseudo-facilitator role and support stakeholders to make sense of the response, find solutions to the blockages, and take corrective action, and all while this was still able to make a difference. So before starting out on our real-time evaluation, we really sought we sought clarity and consensus from our primary stakeholders about the purpose and scope of the evaluation, what will constitute a good evaluation when you compare speed versus rigour. And we also had to really ensure that our team was well prepared and had the skills and resources to achieve the stakeholders' expectations and standards around what they thought they were going to see from us. And our team formed organically. Several of us saw the need for the evaluation. We assembled and then we consulted with board on the opportunities and benefit of a real-time evaluation. And this is very important because you are talking about undertaking intensive work in a period where there's a crisis response. So you really need that agreement before you embark on something like this. And a bit challenging for us, most of our stakeholders within AEW had never seen a real-time evaluation and they didn't know what to expect from us. But on a positive side, this really gave us quite a lot of freedom and latitude to examine a raft of matters using a real array of methods. So for our data and evidence gathering, we had structured interviews, internal documents, analysis of administrative, portfolio and economic data. We interviewed we conducted 252 structured interviews with 532 people, and most of those people were AEW staff, government counterparts from member countries, and development partners. We also met with 27 ministries of finance to get their perceptions on the quality, speed and efficacy of AEW support. And because we couldn't get into the field, we conducted country case assessments in 5 countries using virtual missions. And we used big data. So we were trialling innovative approaches around social media data mining to better understand the indicative perceptions of people out in the countries where we were looking, so we could triangulate what we were hearing from AEW and the government at the time, or governments, I should say. So our evaluation was designed to inform and support ongoing interventions and to get lessons for future operations as well. And it provided an assurance function. It wasn't designed for accountability or compliance purposes. And it was timed to occur in the crisis and planned to be iterative over a longer period. We originally anticipated that we might submit 1 or 2 notes to our board, but the demand for real-time evaluation information grew throughout the process, and we ended up producing 4 fairly comprehensive notes that we shared with our Development Effectiveness Committee. So just to give some perspective of how impactful these notes were at the time, the information, for example, that we shared on note 2 was so well received by the committee that we were asked to then present it a second time to our full board. And this was actually the first time that IED has ever been asked to represent an evaluation to a full board in history. So that indicates how seriously people were taking the information and how broadly they wanted the information to be understood. We used a traffic light system in our reports so that the decision makers could quickly understand where something was working. So it was shown as green. Where it needed closer monitoring or attention, it was marked as amber, and where it was off track or needed immediate course correction, it was shown as red. And this was the first time that IEDs used a traffic light system in our evaluations, and it was really well received by the reader because they were able to very easily and quickly pick up what was a problem and what was okay. And process and a tool to help improve the quality and performance of the COVID response. Yeah. So that concludes my presentation, and I'll now hand over to Jane, my counterpart from UNICEF. Thank you.
Thank you very much, Melinda. Thank you, Sona. Thank you, Richard. It's really great to be part of this discussion. And it has been interesting for many of our organizations in regards to looking at real-time evaluations and formative evaluations. So before I jump onto that slide, I just want to begin by saying that for UNICEF, our mandate is children. And we know that during the COVID pandemic, children were among the hardest hit by COVID. And our executive director, in her speech to the executive board in June 2020, put it very eloquently. She said that children were the hidden victims of COVID-19 pandemic. Lockdowns and school closures were affecting their education, mental health and access to basic health services, and raising the risks of exploitation and abuse. We know that due to COVID-19, we saw the largest disruption of education in history, affecting more than 1.5 billion learners in over 190 countries. Also, remote learning induced a digital divide that exacerbated inequalities. Coverage of most important childhood vaccines was severely disrupted as governments prioritized COVID-19 interventions. Then, of course, we also saw a decline in nutrition services. Confinement measures and disruption of violence, prevention response services accelerated serious child protection risks, including violence, child marriage and pregnancies, and mental health. In a word, we saw the main gains that had made in child development in previous years wiped out during the pandemic. So this is what we had. And in terms of UNICEF, the COVID-19 was declared an L3 emergency. That is the highest level of emergency that can be triggered within the organization. And this means that it was an emergency that required the response of every level of the organization. That as an organization, we needed to invest all resources to ensure that we were working with government and other partners to really deliver services for children and their communities. So looking at this slide, I want to talk about the transformation of methodologies. We realized that the pandemic created disruption that affected all aspects of life. And as evaluators, we needed to think outside the box. We needed to do business differently. Fortunately for us, the evaluation function was encouraged by the executive board and also by our management to consider different kinds of evaluative work on the effect of COVID-19 on program work and for adaptive management and learning. We needed to ensure that what we were proposing would enable quick decision-making because we realized that real-time evidence analysis and feedback was going to be critical for our management. For our case, we needed to ensure that the methodologies were repurposed so that they could be agile and responsive, and also to draw on innovative tools and approaches that enabled the rapid generation, dissemination, and the use of evidence so that our country offices and our regional offices were going to use that evidence to really make critical decisions in regards to how they were going to respond. At the same time, we know that global lockdown measures forced remote methodologies to be designed. So we needed to ensure that these were lightweight and implementable quickly. Utility was what was on everybody's mind, including our management. And we were told to always consider being fit for purpose. So even when we were thinking about this real-time evaluation that I will speak about, that was one of the major considerations. For us, another key point was discussing and agreeing on what was good enough evidence that could be used by our management to make critical decisions in regards to changing programs and policies. And of course, in all these considerations, the principle of do no harm was consistently used to guide our efforts. You will note that this was a real-time evaluation stroke assessment because for some regions, talking about evaluations during a global crisis was almost like a no-no, while in others, evaluations worked. But in reality, real-time assessments and evaluation in this particular context was exactly the same. It was another example of how the evaluation function repurposed its approach during the pandemic. And given that many colleagues in top management consider evaluations time-intensive, we needed to demonstrate that it was possible to undertake light enough evaluations that would be useful for decision-making, and at the same time, recognizing that everybody, particularly our colleagues in country offices, were very busy with the response. How the response was structured at the global level, we had some senior management meetings, which brought together regional directors from HQ, as well as other senior management of UNICEF. And in these meetings, very early on, the regional directors indicated that they were operating nearly blind in undertaking the coverage and quality of UNICEF's response, given the very unusual remote working modalities. So in reality, the requests for real-time evaluations came from the regional directors. They indicated that they needed to better understand how UNICEF and country offices were adapting and responding to COVID-19. And very specifically, they wanted to know what the effects of COVID-19 pandemics were to basic services, especially for the most vulnerable populations. They also wanted to know what the implications of COVID-19 was on UNICEF's regular and pre-COVID program delivery. How was that affected because of COVID? Also, how are countries repurposing their response to respond adequately? How are we adapting? What evidence were we using to even adapt? And then also, how could we assess the coverage and quality of the response? Other questions that came up during those conversations with senior management were we really reaching the most vulnerable? What were our targeting criteria? How did we know that we were providing quality interventions? Because the usual country office activities, for example, going out on monitoring, were not taking place. Other issues that the management was very interested in was what were the early lessons? What was emerging from the response? What were the emerging positives? What were the greatest challenges for the country offices? And then also, what should we be considering moving forward so that we could really enhance our programming? Therefore, the real-time evaluation was a means to support regional offices in their oversight role vis-a-vis the implementation of the country office responses to COVID-19. It was designed by the evaluation office in close collaboration with all 7 regional offices. It was managed by the regional offices, especially because we wanted to ensure ownership. But at the same time, we coordinated and provided the technical support from the evaluation office. And we also worked very closely with we had a COVID-19 secretariat. So we worked very closely with them to ensure that the evidence that was going to come in was also going to be presented during those meetings to ensure that the uptake was immediate. Regional offices, regional reports were prepared and discussed during critical regional meetings where all country representatives were coming together. And then also priority issues were agreed upon. Specific regional reports were prepared. And finally, from the evaluation office, we prepared a synthesis report from all these different evaluations. And this has also been a major input towards the UNICEF COVID-19 evaluation that we are just concluding. And before I conclude, this is also to say that this approach resonated with very many countries and regions to the extent that although we only had one initial phase, many other regions have undertaken other rounds of the real-time evaluations. And some of the topics they wanted to assess included topics like return to safe learning, mental health and psychosocial support, vaccine uptake, and so forth. So yes, indeed, it was a very big exercise. We are still reflecting on it until now, but in reality, we do feel that it served the organization's need for real-time evidence to make those critical decisions, particularly during those first year of COVID response. Thank you very much. Back to you, Sona.
Thank you. Thank you so much, Jane, Melinda, and Richard for the very comprehensive and clear presentations while keeping them still succinct. And also Jane and Richard, some very sobering information and updates in terms of the impact on children and human capital development more generally. To me, what the experiences highlight is that really there's no one size fits all. And as you have shared, all the three organizations have the independent evaluation colleagues in particular have really tried to make the design and the implementation of their respective evaluations as country-specific, context-specific as possible, while meeting the challenges of being timely, very timely, real-time, in fact, in some cases, while meeting the quality and the rigor requirements. So you have already touched upon some of the discussions that went on early on in terms of the internal deliberations, both within the department, of course, but also within the organization. In terms of early discussions regarding the scope, the methodology and the approaches, the specific evaluation questions, of course, issues related to staffing, staff and other resources being available while we are still maintaining, going on with our other normal evaluation work program. So these are some of the very important considerations that I know that all evaluation departments need to consider. So perhaps we can spend a little bit more time in discussing that from the perspective of each of your organization. And also all of you emphasize the importance of stakeholder consultations and getting the early understanding and buy-in so that the uptake of the findings will also be strengthened later on when the evaluations are completed and disseminated. So maybe I start again with Richard. If you could share your perspectives in some of these regards, but also specifically, I noted that you said for the UNDP, it was somewhat of a challenge early on to generate understanding and acceptance of formative evaluation, especially given that this was the first time that IEO was conducting a formative evaluation ever. So there's this issue of first, the department itself understanding the approaches and learning from other organizations perhaps, and also generating this understanding more broadly among your stakeholders.
No, I mean, you're perfectly right, Sona. It wasn't an easy process where we knew it was too early to do a summative evaluation, and in many ways it wasn't fair to even begin to do something like that. But then formative evaluation being so new, we effectively had to go back to the textbooks and sort of dig out descriptions of what the process would look like and explain and sit with our colleagues and sort of, say, well, we're not focusing on impact here. We're not focusing on sustainability. We're touching on effectiveness. We're touching on efficiency. But we really want to see if we're in the right place. We want to see if UNDP is given everything that has happened, if UNDP is in a place where coming out of the pandemic, it's going to be able to help countries to recover. And the key thing we saw as one of the key elements that needed to be supported was UNDP's role in fiscal and financial activities. I mean, we're not a bank. We don't have money. We don't lend. But we had positioned ourselves where we were giving advice. And in some countries, we were trusted because we weren't lending money. We were trusted, UNDP was trusted a bit more for having less biased advice, if you like, in financial and fiscal matters. But that said, we had to spend a long time. And when we conceived of the evaluation in January 2021, we didn't really complete the terms of reference until May 2021. And that was partially because we went through such an exhaustive sharing process, sitting around the table, discussing the TOR, discussing the scope of the terms of reference and the objective, and even down to the individual evaluative matrix questions and sources for information. Then as we progressed, I mean, as with every evaluation, as you open one door, you start to go down different pathways. And whereas normally we'd have just gone down those pathways and saw where it took us, we were quite careful to make sure that as we went down through one door, we made sure that the evaluant knew where we were going, so that there were no surprises at the end, because we couldn't afford to have the normal battle you might have over an evaluation at the end. We wanted them to come with us. We had sticky moments. We didn't agree on everything, but we felt that we had taken the journey together, for want of a better phrase, and that when we got to the end, we at least understood where we were both coming from the evaluation, and therefore we could agree on many of the things that the evaluation found, and we could agree to disagree on the other elements, with a proviso of let's wait and see what the impacts are coming out. So it really was a participatory process. We didn't get everything right, Sona. We got lots of things wrong, but we learned from that, and we've rolled those lessons into the next formative evaluation we're doing now on UNDP's integration of leave no one behind principles in its work. So it was a learning process, but from both sides.
Thanks, Richard. What about you, Melinda? You talked about the real-time evaluation and how the plan to conduct in terms of the timing, the number of evaluations evolved over time. And also you mentioned that fairly early on, there was an understanding that these evaluations were going to be used for learning purposes. So the team did not have specific recommendations as we typically do in our other large evaluations. And also you mentioned the traffic light system. So if you could please elaborate on some of these or other important considerations that the team had to take into account in the plan design process in particular.
Yeah, thank you, Sona. Yeah, it's actually consistent with what Richard just said, in that he needed to get the messages through in as smooth a way as possible to ensure that the messages he was delivering were impactful. We took a slightly different approach, and in hindsight, we potentially could have examined in more detail what stakeholders wanted and expected of us. But we took a slightly different approach for expediency, and it worked really well for us. So we actually submitted our 4 notes to the board as confidential notes. So we haven't published them, and we won't plan to publish the content. Nothing in there is particularly sensitive. A lot of the information's been later shared in other documents and in other discussions. But what we really wanted to do was establish a particularly high level of with our stakeholders during the crisis. And we wanted them to know that we were undertaking the evaluation for better outcomes and that none of it was for show. So in undertaking confidential notes, or in producing confidential notes, we also managed to avoid the lengthy systems and processes in AEW that you have to undertake to get to publication. And we knew that if we were publishing, that we would have been delayed in getting those messages out in a timely manner, where the information could be useful to the decision makers. And this also comes back to using the evaluation for lessons and assurance as opposed to accountability and compliance purposes. Another really important reason why we did this is that the time it takes for ADB to publish a report being quite extensive would inadvertently distract key stakeholders like board and management at a crucial time while they really were undertaking the largest crisis response on our record and in record time. And we didn't provide recommendations because when IED gives a recommendation to the board, it goes diligently into a tracking system where we monitor the recommendation through to its implementation. But we didn't want to have that pressure given that the context was evolving so rapidly in 2020 and 2021. We knew that we only ever had part of the story at any given point in time, and that we were providing deliberative material to enable course correction if it were necessary. And so not providing recommendations was also something that really helped us in our process. In hindsight, not publishing our notes and not providing recommendations really did help us to expedite processes and to meet our objective of getting information to the board and management faster. So different approach to UNDP, but it worked quite well for us.
Great, thanks, Melinda. Turning to Jane now, as you have described, the scope of UNICEF's rollout, especially of the evaluation in several regions and a deep dive in close to 50 countries, I think, seemed like quite a massive undertaking. So in terms of the early determination of the scope and the scale of the evaluation, what are some of the considerations? And also I wanted to ask you to specifically share your experience in terms of the stakeholder consultations in particular in that context. And finally, you mentioned the principle of do no harm, and that's a topic that comes up frequently in the context of rapid assessments during crisis situations. So I would be really interested in hearing a bit more about that as well from you, Jane.
Thank you very much, Sona. Indeed, the real-time evaluation for us was a massive undertaking. Again, given UNICEF's context, we work in more than 190 countries and territories, and programming is very, very varied. The way we program in Eastern and Southern Africa is quite different from how we program in some of the countries in Asia Pacific, for example, and also very different from how we program in Eastern Europe and Latin America. So we needed to ensure that we were getting good evidence from all these different contexts so that we could really utilize that for making decisions. So so that is why we agreed that, yes, indeed, we are going to involve and engage all the 7 regions, and to the extent possible, a number of countries in each of the regions, because we wanted to get more evidence in terms of how UNICEF was programming, the challenges, the strengths, and so forth. So and this was, in the end, we actually found it very useful because we did get quite a range of findings, from all these different contexts. Countries which were usually doing upstream and advocacy work, and then suddenly they needed to step up on the plate and do more with government to ensure that they were supporting governments accordingly. Everybody had to step up, and kind of just like getting all that evidence from all these different contexts was very useful for management to really determine how they were going to support specific countries to really scale up and ensure that the UNICEF was supporting government and other partners to really scale up the response. Then in terms of stakeholder consultation, I think for us, I must say that the fact that the request came up from the senior management that made our process much easier. Was it easier throughout? Not necessarily, but at least it really did open doors for us, given that the regional directors were on board, and as a result, they communicated the same with country offices. So in our case, we communicated with the regional offices. And for UNICEF, we do have a decentralized evaluation function. So for all these 7 regions, we do have regional evaluation advisors. So we worked very closely with them to ensure that they were owning the process, that they could customize this tool further, include additional questions that were more relevant for their context and so forth. Then for country offices, we left this pretty much to the regional offices, but of course we also supported in whatever way we could. And then of course, as part of the data collection, we wanted to ensure that it was not only UNICEF's voice. We wanted to ensure that we were consulting other partners, including donors, government partners to the extent possible, as well as communities. So this again varied from region to region, but even in some of the regions, we were even able to do some focus group discussions with frontline workers as well as communities. So the consultation was actually quite diverse, but again, it varied from region to region given the capacities. And then on the issue of do no harm. Yes, indeed. It is something that we always consider, especially when we are undertaking evaluations in a humanitarian context. And in our case, this is something that had been discussed, that country offices were really trying to navigate how to support government. It was also new. COVID was new to everybody. So they were trying to navigate how they can support, and they were so busy with the response. So we had been told to ensure that the tools and the approaches we're going to use were very, very light, so that it was not going to be a distraction from that kind of work. And then also ensuring that that even for the communities where we were collecting data, that even when we were talking to the frontline workers, due diligence was undertaken to ensure that we were not doing any harm. Back to you. Thank you.
Thank you very much, Jane. Turning maybe to the issue of various challenges that some of you, all of you have highlighted, but perhaps maybe focusing specifically on some of the challenges on the information and data collection side. One consideration is, of course, the time, the speed at which these evaluations need to be conducted to be relevant and timely. The second is just the general issue of just, there not being reliable, adequate data in a number of areas that we work on, even during normal times. And finally, and very importantly, the question of being mindful in terms of not adding too much burden on our stakeholders and member countries at a time when they are really stretched. So with this background, perhaps you could specifically talk about some of the ways, the approaches where you were, the challenges and how you overcame them, and to strike the right balance between having enough evidence base and data for them to be credible. Maybe we can start with Melinda this time. You mentioned that IED used a number of innovative approaches in the data collection and triangulation process. Could you share some specific examples, please?
Yeah, thank you, Sona. This is actually one of my favourite parts of the real-time evaluation work that we undertook. Our board really wanted to know what partner governments thought of ADB's assistance. They wanted to know that they were getting it right. And it was so hard to get out into the field and get those perceptions during so many lockdowns and border closures that we had to really adapt and overcome. And two of my favourite parts of all of the work that we did were 5 country case assessments in Bangladesh, Cambodia, Mongolia, Philippines, and Papua New Guinea. So remote missions, it was fantastic. It came with a raft of challenges that you can all envisage by this stage. But, making sure we established the right systems and processes and had the right tools to meet with the right people at the right time was just crucial. And key to that was engaging the, someone in each of these countries who was incredibly well connected and could enable us to meet with ministers and deputy ministers and secretaries of departments while they were truly addressing a crisis themselves. So I can't understate how valuable that experience was in those 5 countries for us, and the information that we were able to get through those meetings was really valuable in giving the board assurance that, you know, things were happening in the way that AEW staff were thinking that they were happening. So that was fantastic. But one of my next favourite pieces of work that we did was social media data mining, so big data out of Facebook. We were working with data scientists to get indicative perceptions of COVID-19 support to 2 of our countries, because we were trialling this as an approach, and we used Papua New Guinea and the Philippines. So data were mined from about 150,000 posts and comments on Papua New Guinea's top 10 Facebook sites, and over 1 million posts and comments from the Philippines' top 4 sites. And the data revealed, naturally in discussion around AEW and other things, that the most common topics were health and COVID-19. So we used these 2 topics to then compare sentiment data to understand the keywords and how people felt about what was occurring. So we used opinion mining, and we did this to determine attitude, polarity, and emotions on Facebook. And the indicative perceptions came through as relatively neutral to positive. And I must admit, I think we were all really quite surprised at the time, because the context in these countries was so challenging. No one expected neutral to positive and optimistic at the time. So further analysis, we dug into the next level to look at sentiment, and we found that there was relatively similar positive sentiment, and this was shown through a combination of fear and trust as a neutral emotion. Sadness and anger were more frequently expressed, and it was more frequent than anticipation or disgust, and joy and surprise were less frequently expressed. So in trialling this data science approach, I can say with certainty that we weren't able to draw specific conclusions about the impact of AEW support at the time, but we were able to get an indication that the beneficiary populations had largely neutral to positive views, and we were able to share these with the board at the time. And also, quite excitingly, the data that we took then from the social media sites can now be compared with the exact same keywords today, and looking at sentiment and polarity to actually understand how the sentiment has changed over time. So it was, you could use this information as a baseline to compare it with today, and to compare it even with other crises in the future. Thanks, Sona.
Thank you. No, that's really very interesting, especially channeling the power of social media, I suppose. That's great, and we should definitely think about how we could apply some of those approaches in our evaluations in general when they're relevant. Jane, I'll turn to you next, again on how UNICEF tackled this particular challenge in relation to timely information and reliable data, and when the team determined that it was good enough, because of course one could keep on collecting more and more information, but at some point you have to make a judgment. So if you could share your experience in that, that'd be great.
Yeah, thank you very much. I think when we came up with the key evaluation questions, we also determined what sources of data we were going to use. So, and we wanted to the extent possible, despite it being a real-time evaluation, we wanted to the extent possible to use different sources of information that were readily available. So what was interesting, and this is also a contradiction, during the COVID response, I don't think I've ever seen country offices generating as much data as they did during that time. There were a lot of requests from HQ and regional offices to country offices to provide data on coverage, data on gaps, data on challenges in implementation and so forth. So, and I'm saying that is a challenge because we've been talking about data gaps. So it is, how do we maximize on what was available, and at the same time trying to determine, can what is available answer the key evaluation questions. So we had agreed that as part of the real-time evaluations, we would undertake analysis and also synthesize data and evidence that already existed in our internal UNICEF systems. And we had a lot of that, including funding, the targeting, the coverage, the gaps in sectoral support, and so forth. And then also, we agreed that we are also going to use other methods, for example, key informant interviews, and that also included this for senior management, government, to whatever extent that was possible, and CSO partners. We also utilized mobile phone polling data, especially because we also wanted to hear back from communities, including their perceptions, as well as gaps in coverage of some of the interventions. And then also, like Melinda has indicated, we also attempted to use big data, analyzing it, getting a good sense of what it was saying, and trying to see how we could, how that could be used to respond to the evaluation questions. And then also, as I said earlier, it was also possible to undertake key informant interviews with frontline workers, focus group discussions. To some extent, in some of the contexts, it was only possible to do that through mobile phones because consultants could not travel to any of these locations. But the fact that UNICEF already had a list of all, many of their partners, including their telephone numbers, that facilitated a great deal. The other issue that you asked was in terms of, what have been the lessons? For us, there was a lot, and we are still also reflecting on some of these lessons up to now. But I think what has been useful to see is the fact that it is possible to undertake evaluations and provide critical and timely evidence for decision making, even in times of global pandemics. We were questioning, we were wondering whether it was possible, but I think once we started thinking outside the box, it was possible for us to start coming up with methods and tools of how we could do that. Another one, and this is also very much related to what Melinda said, is that it is important to communicate and ensure that everybody that you are dealing with has a good understanding of what real-time evaluations are, what they include, what they don't include. In our case, we were deliberately indicating that these ones were learning, the focus was largely more for learning and less on accountability. And I think this also helped people to feel confident that we were not evaluating them for accountability purposes, given that COVID was all very new and we were all navigating that space. Also getting good consultants. And in our case, I think all organizations were fighting for the same kind of evaluators. And as a result, some of our regions delayed the real-time evaluations because they could not get consultants on time. And then just like also what Melinda indicated, it requires additional efforts to engage with stakeholders using different approaches. It requires ensuring that you still have good results monitoring systems in place despite the challenges. And then in our case, what worked well, I think primarily was the champions who are the executive board who told us to do things differently. That resonated very much within the organization. And then also the fact that the real-time evaluations was requested for by senior management ensured that the hurdle of the utility component, how are we going to use these evaluations, was eliminated. They already said they wanted that evidence. They wanted it to make decisions. So just ensuring that, I think, was also very important. And then, we also got funding. And I think this is a critical component because we knew that if you tell regions, okay, fine, we want you to undertake these real-time evaluations, the first question will be like, but where are we getting funding? So all the regions were provided funding through the COVID appeals, and that facilitated a great deal to ensure that these evaluations were undertaken on time. And the fact that, as I said earlier, we do have capacities at the regional office and country office level because of our decentralized evaluation function helped us a great deal. We would have those meetings to discuss questions, to discuss methods, to discuss how we were moving and navigating the space of undertaking many of those evaluations remotely. And that helped a great deal because it was all these different minds coming together to help, kind of scope the evaluations and ensure that we were asking the right questions. Then finally, before I hand it back over, of course, there are quite a number of things, just like Melinda and Richard have indicated, that did not work well for us. Tight timelines. In hindsight, sometimes real-time component is not as strong as we had planned. Real-time data analysis was challenging for some of the regions and countries. And in some cases, there were so many delays to the extent that they were not real time anymore. But I think also in ambitious data collection, because we wanted to triangulate, we wanted, as someone asked the question, what is good enough evidence? We wanted to ensure that despite us undertaking these evaluations remotely, we still wanted to ensure some depth of evidence. So we wanted to triangulate, we wanted to speak to different stakeholders, we wanted to conduct online surveys. So this very ambitious data collection process also made some delays. And then finally, it is on the dissemination. We did see a lot of uptake, including at regional offices, but we always believe that we could have done more to ensure that we had opportunities, especially at the country office level, to really maximize on some of these evidence. But otherwise, it was a useful process. We have learned a lot, and at the same time, there are a lot that we can take forward to enhance such processes if we are to undertake them in future. Over to you. Thank you.
Great, excellent. Thanks, Jane. Thanks for outlining an excellent set of lessons that I am sure resonates with all of our organizations and evaluators more broadly. I see that we have a few questions come in, and I'm mindful of the time. So perhaps with the lessons learned outline that Jane shared, that's a good time for us to pause the discussion among panelists and take some questions from the audience. So let me start with the first one. It is directed at UNDP, Richard, and it's related to the issue of data as well. So the question is, what minimum standards were applied in the RTE to ensure the quality of collected data and meaningful findings? Please explain more the light evaluation in the scope of your evaluation. How are ethical issues considered and ensured? So, Richard,
it's a multifaceted question, but I guess leading on from, in some ways we're our own worst enemy, and I think when I mentioned the issues with data, I think when we started the evaluation, I had expected to be able to open a box and find all of the SDG impact data from COVID-19 in 2020 and all of the financial impacts. And of course, that was completely unrealistic. We started the evaluation and data collection in March 2021, and we were barely actually seeing any reliable data coming through at all. The most reliable data we had was from the IMF and the Fiscal Monitor, and all of their data was predictive data. So we very quickly realized, look, we're not, if we wait for data, it's not going to happen. So we decided, but saying that, the solid data wasn't there, but that's not to say we weren't awash with analysis. There were reports on the impact of COVID on poverty, on gender-based violence, on labor, on every aspect of socioeconomic life. And UNDP itself was producing 140 plus of these in the first year. So we had a good and analytical base of what everybody thought was going to happen. And what we did was we felt very solid in what the process was going to be. the fiscal, the financial constraints, the SDG impacts. So we took that, just as Melinda did. We had 10 country case studies. We used a couple of local evaluators to do the case studies, and we did. By the way, this entire evaluation was done desk-based and remote, which was another challenge. We had a team of about 15 people operating all over the world. But we tested we had an evaluation matrix. We knew what we were looking for. We had all of this analysis. We had evaluation questions that we then took down to the country level, and our team evaluated, met with ministries of finance, ministries of planning, UNDP, and we tested that analysis. Are you being impacted by fiscal constraints? How is your budget sheet looking, your balance sheet looking? How do you see your position being in the next 2 to 3 years? And that enabled us to triangulate that analysis and the predictive data we had to come out with a pretty solid picture of where we felt the direction everybody was going in. I don't think I would call it a light evaluation. It certainly didn't feel light at the time. Just like Melinda and Jane, I think we interviewed in the end 600 people across 10 countries. One of the really, just thinking about it again, one of the big strengths to the evaluation was the fact that we were, in many ways, because it was formative, we were looking at the organization strategy. So by speaking to colleagues at UNDP in the country level, they were often very honest with us on where they saw gaps in the strategy, because they were having to implement it and they saw what they were going to have to implement coming forward. And many of the strongest stories were not coming from partners. They were coming from country offices which were overwhelmed by COVID, that were overwhelmed by direction and methods and data collection, just as Jane alluded to, and who were saying, look, we're going in the wrong direction. We need support in X, Y, and Z. We don't need it in 1, 2, and 3. So we had quite a balanced approach, and some very interesting results came out from some interesting areas.
Great, thanks, Richard. I'm mindful of the time, and we do have a couple more questions to cover. So let me go to the next one. This is addressed to UNDP and AEW. The question is, how do you see the role of national evaluators in the RTE during the pandemic? Are there any good examples of working with national evaluators and increasing their capacity? So if Melinda and Richard could briefly share your views on the use of a very important, actually, question related to working with national evaluators and building national evaluation capacity more generally. So Melinda, I'll let you start, please.
Thanks, Sona. So the opportunity we had to work most closely with national evaluators came through when we did the 5 country case assessments. And we found the role of the national consultant crucial to the success. But we actually took a very different path to what you may expect. Instead of recruiting and engaging consultants who had extensive experience as evaluators, we took a different approach and engaged consultants who were exceptionally well connected, who were able to access the level of government counterpart in a time frame that we needed to enable us to undertake interviews and get information quickly. And this was supported by a raft of information and processes that we had sitting in the background. So we set up systems and processes to help them to report on what was occurring in the discussions, but it was templated, so it was quite clear when we asked a question, what relevance was, that the person who was working with us nationally knew what it was and would be able to talk and report on that with us. And their role was so crucial and helped us to really move through adverse circumstances. For example, in some countries where we had government counterparts working from home instead of in their office during lockdowns, they didn't have consistent and reliable internet. And we had our consultant physically sitting at locations like cafes or in other people's offices with government ministers and department secretaries, and with their phone on WhatsApp loudspeaker on a joint phone with us, we were conducting interviews. It wasn't traditional in any way that you would expect, but it was highly effective in getting the results that we needed. And I can say with absolute certainty that it wouldn't have been possible for us to have covered the depth and breadth of stakeholders that we did without these crucial national consultants. So from my perspective, they were really key to our success on a major data and evidence gathering part of our evaluation.
Great, thanks, Melinda. Richard, please.
Maybe Jane, because she might, I think she's got a lot of experience more than us. I just say, because we used a group of consultants, some of them were locally based. They work very well. Just maybe a little reflection, UNDP managed to somehow do in 2020 and 2021 with all that was going on, not our office, but UNDP as a whole, 600 evaluations. Nearly all of those done remotely, nearly all of them partnering with national consultants who did most of the legwork in the ground. So it was a great effort from UNDP, but equally, I think it really boosted the profile of national evaluators, and showed that we do have a really good pool of national evaluators out there, and we should be using them more.
Thank you. Jane, would you like to come in as well, given your experience?
I think they have said it all. Yes, indeed, some of the regions did use national consultants, and it's always a great way of enhancing capacities. At the same time, everybody was undertaking evaluations. So even some of the national consultants that country offices would normally go to were already busy with other, So it just says that we just need to expand the national capacities, because if all of us are undertaking evaluations, then we'll always have a gap. But it was, colleagues have indicated that it was very useful to just have them on the ground. In some cases, even in communities where UNICEF was programming. So they would really provide useful information and evidence from the implementation itself.
Great, thanks a lot, Jane. Okay, one final question, perhaps, and I would just throw it out to the panelists. Please feel free to take it up. So the question, could you reflect on the differences, if any, between real-time evaluations and what some have called the more standard formative evaluations, like organizations such as IED and others do? So maybe differentiating between the two types, types of evaluations that we talk about: real-time, informative, and more standard evaluations. Who wants to shed some light on that?
I'm happy to speak.
Go on, Melinda, please.
Yeah. So from my perspective, I think that there's a lot of classification among the traditional evaluators about the role and responsibility in evaluation versus monitoring. And what we see with real-time evaluation compared to formative evaluation is that it has a propensity to be used in a crisis context. So real-time evaluation isn't being used for circumstances where other formative evaluations can occur because of the costs associated with doing a real-time evaluation. It's not just the costs of assembling an evaluation team, but it's actually the real costs of undertaking an evaluation during a crisis and the cost of taking decision makers and operations teams offline to work with us while we do that. So there's a really important need at the outset to confirm that an organisation is actually able to adapt and change its operations or policies or programs during a crisis. Otherwise, it might be best sometimes to just wait and do a evaluation after the crisis is completed. And other things, that people tell you are that a real-time evaluation compared to a formative evaluation really blurs the line and bridges the gap between monitoring and evaluation. And this takes a lot of people outside of their comfort zone. So you really need to ensure that your team want to undertake a real-time evaluation in a crisis, and that they feel prepared to be flexible and adapt to almost play a pseudo facilitator role to get information out to the decision makers in a time that they can use it. So from my perspective, there's a real difference between real-time evaluation and other formative evaluations of policies or strategies when it's not a crisis. Thank you.
Great, thank you, Melinda. Any of our other panelists want to add very briefly?
No, I mean, I agree there with Melinda. I think we weren't really in a position to do a real-time evaluation because we saw things were adjusting so quickly. Realistically, the formative evaluation could have been done at any time. It was just positioned well because of and we're showing that now with the leave no one behind. It was well timed in that we had a crisis around fiscal and financial crisis emerging. We had these tools that were emerging, and we had a strategic plan that was coming out. So in that way, the formative evaluation worked because we could reflect on all of that and say, you know what, given where we're going as the world and an organization, this is the direction we think our work should go in. But it wasn't, it was a very different approach to real time. It wasn't quick, it wasn't snappy, and it's looking at strategy more than real time decision making.
Great, thanks, Richard. Jane, would you like to have the final word on this?
I think both Richard and Melinda have put it quite well. Possibly the only consideration I can say is that unlike how the real-time evaluations had been positioned in the past, we are seeing, and UNICEF is undertaking quite a number of real-time evaluations, especially in conflict situations or emergency situations rather. And it is the depth and the independence of these exercises. Initially, we saw that real-time assessments and evaluations could even be undertaken by internal staff. But now increasingly, we want to ensure that the independence lens, so we are bringing on board evaluation offices and also external consultants. So the rigor is there. It's just that we want them to be undertaken in a much speedier manner because it is critical for decision making.
Great, thanks.
But they are not lesser, they are not lesser evaluations, so to speak.
Right, thank you.
Yeah.
Well, we've come to the end of the session. This has been such an interesting and enriching discussion, and I would normally try and summarize the discussion, but I clearly would not be able to do justice to the depth and the details of the discussion. So I would just like to end by thanking again our panelists. Really appreciate your taking the time to join this panel. So thank you again to Richard, Jane, and Melinda. And also thank you so much to all our participants for joining us. And we look forward to engaging with you again in coming days. Thank you very much.